When searching for a cosmetic surgeon, there are a lot of options out there, a lot of great physicians, a lot of great plastic surgeons. A lot of them are men, and so I feel that being a female, I can give a special perspective to the woman coming in for consultation and a more compassionate view.
Dr. Learn does a lot of breast reconstruction surgeries, as well as full abdominoplasties, tummy tucks. Liposuction is a big one for us as well. And we do a lot of the cosmetic fillers and injectables like Botox, Dysport, Sculptra, Juvederm. The majority of our patients are females, so I think they can relate to her, and she is able to connect with them.
Knowing that you've changed someone's life and changed it for the better is probably the most gratifying thing that I experience in plastic surgery. Some people feel that undergoing plastic surgery is vain and that it's just perpetuating their vanity. But, we try to put the best foot forward every morning. We get up, we shower, we comb our hair, we put on makeup. So it's not necessarily feeding your vanity. It's making you feel better and improving your self-esteem.
I think we do have a lot of patients that come here wanting to kind of keep up with that. But we kind of keep it very minimal as far as we don't like to overdo it.
In this day and age when excess seems to be the norm, sometimes I have to tell patients, no, you really shouldn't have more injections into your lips. Or no, we shouldn't do another facelift. When people start to look not like themselves, I think that's the point where plastic surgery needs to stop.
I had a bilateral breast reduction. I went from a 34 double D to a 34C.
She had what we call symptomatic macromastia. That means that her breasts were enlarged and it was starting to cause issues with back pain and starting to affect her daily life.
If I wore a bathing suit or a bra, I would get lots of marks in my shoulders. So a lot of pressure here. And then also just for my confidence, I just did not like how I looked in a lot of clothes. I couldn't wear a lot of clothes, so a lot was just life-changing. First of all, I don't have any more pain as far as my back and my shoulders.
She says that she has a whole new outlook on life. Clothes fit better, she feels better, she's more active, and her self-esteem is improved.
It definitely made me feel a lot better about myself.
To see them once they're done with their procedures with Dr. Learn, they're so happy, they have more confidence. It feels good.
Yo soy sobreviviente de cáncer de seno y hace 5 meses me hicieron la doble mastectomía y luego yo decidí hacerme la reconstrucción y fue entonces cuando yo conocí a la doctora Learn y decidí que ella me hiciera la reconstrucción.
She was diagnosed with breast cancer and had a double mastectomy, kind of like Angelina Jolie. And I was able to do the first stage of her breast reconstruction so far, and she'll be coming in for her second stage, which consists of removing the current expanders that she has in and replacing them with permanent implants.
Toda mi familia y amigos que me han visto, les gusta el resultado que han visto. Y yo, principalmente, me siento muy bien después de haber tenido una cirugía, una doble mastectomía, haber hecho esta decisión de hacerme la reconstrucción y principalmente con la doctora Learn.
Studies have shown that if you start reconstruction at the time of the cancer surgery or at the time of the removal of the breast, a patient's psychological well-being is much improved. So with reconstruction after breast cancer, we're creating a breast mound, and when they wake up, they still have what they feel is breast tissue. And so they're able to maintain their self-image. They don't have to go through a period of loss or grieving for their loss. And it just gets them on the road to recovery a little sooner.
The reason why Dr. Learn's so great, it is a subtle change, and nobody really knows that I'm even having this done. and it just works slowly, and it's nothing dramatic.
The sculptor has filled in along the arch here, the zygomatic arch. We've also filled in along the lower face. The sculptor actually has improved the skin tone in through this area.
I'll be 70 years old December the 1st, and I'm very glad I don't look like I'm going to be 70 years old on December 1st.
I think Dr. Learn really listens to what the patients want, and their results always show that at the end. Office is very calm. Very calm. The second you walk through, the colors of the walls, the atmosphere, it's very calm, it's very relaxed, it's laid back, which is what we want the patients to feel as well. We don't want it to feel like a medical office. It doesn't feel like it's a factory with ongoing patients going in and out, in and out, in and out. The majority of the big procedures like breast reconstruction, abdominoplasty, or anything that's kind of linked, like liposuction and a tummy tuck, that will be done at the hospital.
The goal is to bring the best out in someone and to enhance the features that they already have.
It just feels good to be here, working for someone who is just doing something good for people.
I'm ecstatic with the results. I really am.
It felt great. I felt super comfortable from the second I walked in here. I felt like it's like I knew her already.
I love you. And after I was been through, you were so sweet and you are so sweet with me, and I really appreciate all how you done with me.
I'm glad I could be there for you.
Thank you.